Welcome to Pharmacology lectures. Today we are going to start about cholinergic agonist. Now these are the name of the drugs we have to study and we will see them in detail. Direct acting, those drugs which will act directly, they are acetylcholine, methanicol, carbachol, sevimicline, methacholine, nicotine, pilocarpine. Indirect acting are also known as reversible, donepezil, androphonium, galantamine, neostigmine, physostigmine, pyridostigmine, rivastigmine. Indirect acting but irreversible. Ecothiopate, reactivation of acetylcholinesterase, pralidoxine. Now these are cholinergic agonists. Agonist means they will mimic the action of cholinergic system. Now we have seen this before. The preganglionic fibers terminating in the adrenal medulla, the autonomic ganglia, both parasympathetic as well as sympathetic, and the postganglionic fibers of parasympathetic division, they all use acetylcholine as a neurotransmitter. Here the postganglionic sympathetic division of sweat glands also uses acetylcholine. In addition, cholinergic neurons innervate the muscles of the somatic system and play an important function in the CNS. Now, neurotransmission or the mechanism of action of cholinergic neurons. Neurotransmission in cholinergic neurons involves 6 sequential steps. Now, the first one is synthesis of acetylcholine. How does it occurs? We'll have a deep look. First is synthesis choline acetyl transferase, that is an enzyme. This choline acetyl transferase catalyzes the synthesis of acetylcholine from choline and acetyl CoA. Choline and sodium, they enters the cell. Choline and acetyl CoA, they both are converted into acetylcholine with the help of acetyl transferase enzyme. Now once the acetylcholine is formed, what will happen? It is taken into the storage vesicles. Acetylcholine is protected from degradation. Once it has been taken in the vesicle, it will be protected. Third, now it should be released in the ganglionic region. Release of neurotransmitter, it is release is blocked by botulinum toxin. This toxin blocks the release. Okay. Spider venom causes the release of acetylcholine. These two are some important points. This toxin will block, and this toxin, venom, it causes excessive release. Okay. These two effect on the release system. Fourth is binding to the receptor. Now once it is released from the vesicles, then it binds to the receptor, postsynaptic receptor. Okay, and once it binds, it will activate the receptor complex. Now after fourth, the fifth part is once it is activated, the chain reactions occur, then it has to be degradation of acetylcholine. Degradation is acetylcholine is rapidly hydrolyzed by, again, which enzyme? Acetylcholinesterase enzyme in the synaptic cleft here. Once it is degraded, choline is released, choline is then reuptaken, and again acetylcholine is formed, protected in the vesicle, released. Some of them will form receptor complex and some of them will again degrade, and the cycle continues. Okay, we have seen these all 6 pathways. Now this will study cholinergic receptors, cholineceptors. Okay, we'll study in the next